Hello everyone, how's it going? It's Dr. Rajeev Fernando, Chief of Infectious Disease at a local hospital in New York. Back to talk to you about the coronavirus. Firstly, thank you so much for all your comments that are coming in at rajeevfernando.com. I appreciate all the feedback. I'm trying to answer as much as questions as possible. So at this point, I'm going to be doing much more updates. I've been requested to. Quite frankly, I'm deeply concerned about the coronavirus situation in this country. So today we're going to be talking about a very important number. Now, we keep hearing on different news channels, are we contained? Is the virus contained? Is it not contained? And I want to tell all of you a number that you need to know to say whether the virus is contained or not. And that's this number over here called the R naught. Now, the R naught is really R0. And what does this R0 tell you? The R0 is a number that epidemiologists and mathematicians have calculated to see whether the outbreak is contained or not. Now, for coronavirus, we do know the virus actually infects 2.2 people. So this you can see over here, how it infects the first two, from there to infect another two over here, and soon we have 8 people that are infected from a single person. So that's important to know. Now, how do we know whether the epidemic is contained? And that's a number. We're looking for a target of R is less than 1. That's important to know. What about some other infections? Measles, for example, the R naught is 18, which means a single person can infect up to 18 people if they're not vaccinated in a span of 2 hours. So that's important to know. Now, what are the things we can do to get this R naught back to less than 1? Because that's our target. We have a lot of work to do. Of course, the government helps. Doctors, nurses, hospitals help, and there's something you guys can do as well. The way that you guys can help us get to an R naught of less than 1 is very simple. Hand hygiene. Let's start with that. Hand hygiene is the single most important thing I need you to do. If you're washing your hands, remember once again, sing happy birthday twice, 20 seconds, you're done. Alternatively, you can use hand sanitizers as well, very important. What are some of the other things you can do? Do not buy a mask, not necessary at all. Some of the other things I want you to think of is social distancing. Stay away unless it's absolutely necessary. Important to know, if you're within 5 feet, that's the big cutoff number. If you're within 5 feet of an infected person, if they cough, you can get infected. But if you're 6 feet, there's no chance you're going to get the infection. That's very important. The other thing I want you to know is also, when you're walking around, get into the habit of hand washing surfaces. Avoid high touch area surfaces like phones, like rails, doorknobs. All this has to be, you have to think about as well. Those you can actually use Lysol wipes or Clorox wipes. And these are some of the things I want you to help us out. So remember, it's a joint effort from all of us. Governments, doctors, nurses, and you guys. So this is what we need from you. Thanks for listening, and I will be back tomorrow to talk about your travel risks, whether you're traveling internationally or domestically. For now, it's Dr. Rajeev Fernando.